Common question is there anything in particular one has to consider when treating a patient with inflammatory bowel disease with fecal microbiota transplantation for C. difficile infection? And indeed, there are a number of considerations, and they probably should be included in the informed consent when approaching that patient. Number one, the success rate in curing C. difficile infection is somewhat lower. Number two, one can get clearing of C. difficile infection, but at the same time, the inflammatory bowel disease continues to progress, and the patient does not experience clinical improvement. Number three, one can get late relapses of C. difficile infections. So in patients without inflammatory bowel disease, if you've been without recurrence for 2 months, you can assume they're cured. You cannot make that assumption in inflammatory bowel disease. They can relapse 6 months later, a year later, and you always have to be vigilant. Number four is the possibility that inflammatory bowel disease activity can flare when you administer FMT. Overall, I think there's still benefit in offering FMT for C. difficile infection in these patients, but the risks are substantial and may approach as much as 50%. For more in-depth discussion, I hope you can join me at the Crohn's Colitis Congress.